Hi, my name is Jocelyn Gallhart, and this is my presentation on gastric dilation and volvulus in canines, also known as GDV. What is GDV? It is a life-threatening emergency veterinary condition where a dog's stomach fills with air, fluid, and twist, causing severe vascular compromise, shock, and potentially death. It requires immediate surgical intervention to decompress, rotate, and permanently anchor the stomach to prevent recurrence, or commonly known as bloat. It's most common in giant and deep-chested breeds such as German Shepherds, Great Danes, St. Bernards, and Dobermans. The clinical signs include retching or lack of vomit, dry heaving, bloat, restlessness, difficulty breathing, pale gums, signs of shock, periodontal is pale, tachycardia, weak pulse. What organs are being affected? The stomach and the spleen. The stomach is located in the cranial upper abdominal cavity, primarily on the left side, immediately behind the liver and diaphragm. The spleen will often twist along with the stomach. Splenic torsion, cutting off its own blood supply. This condition causes the stomach to fill with air and twist, restricted blood flow, necrosis, potential rupture of the stomach. Secondary organs that may be affected is the heart, diaphragm, lungs, liver and kidneys, blood vessels, bloodstream. Compromised gastric tissue can leak bacteria, leading to sepsis. Why is G- GDV important? The condition is life-threatening and only 20% survival rate even when treated. The condition is treatable. Is GDV chronic or acute? This condition is acute as immediate action must be taken, and dogs with the condition cannot last many months or years. If left untreated, it causes shock, and the stomach may rupture and enter the bloodstream, causing sepsis. Although there may be some lasting side effects like weight loss and vomiting, making it chronic, but it's rare. GDV can be diagnosed by X-raying the abdomen, but other emergency treatments may need to be taken depending on the status of the dog before the vet is able to diagnose the dog with GDV. Treatment includes reduce the bloat. This is done 2 ways. For example, oral gastric tube. A tube is passed down the esophagus into the stomach to release the gas and fluid, or tracheization. A large needle or catheter is inserted directly through the abdomen wall into the stomach to relieve pressure. Treatment for shock includes a fluid drip, typically IV or intravenous, to control their blood pressure, which often drops dangerously low in the case of GDV. Strong pain relief to keep them comfortable. Antibiotics to reduce the chance of developing a gut infection and/or sepsis, blood poisoning. Surgery to untwist the stomach, and in worst-case scenarios, euthanasia. Ways to prevent GDV include restrict exercise for 1 hour before and after feeding, restrict car travel for 1 hour before and after feeding, feed several small meals a day instead of one large meal, feed them from the floor. Try to encourage your dog to drink little and often instead of large amounts in one go, but never withhold water. If your dog eats very quickly, consider using a slow feeding bowl or scatter feeding. If you have more than one dog, separate them during mealtime to stop them racing to finish their food. The terms I use as periodontal refers to the tissue around and supports the teeth, including the gums. Tachycardia, an abnormally rapid heart rate that exceeds the normal resting range for particular species. Chronic, a disease or condition that is long-term, persistent over an extended period, typically defined as 3 months or longer, or is recurrent. Acute describes a condition, illness, or pain that sudden onset is typically severe or intense and lasts for a short duration, requiring prompt attention. Cranial, head. Anesthesia, the control reversible informal pharmacological induction of the state that allows procedures to be performed without pain, discomfort, or movement. And necrosis, the premature, uncontrolled death of cells of living tissue within an animal's body. And these are the references I used. Thank you for listening to my presentation.